and avoid recirculation of air and minimize the number of people sharing the same space. We must do this in all healthcare facilities, nursing homes, shops, offices, workplaces, schools, restaurants, and public transport facilities. We have the power within ourselves, working with each other, to limit the damage that this virus does to our people, our society, and to our economy. As we confront the rapid rise in infections, as we ready ourselves for the difficult days and weeks and months that lie ahead, we need to remind ourselves of the absolute necessity of the measures we have taken. On the advice of health scientists and experts, our decision to declare a nationwide lockdown prevented a massive early surge of infections when our health services were less prepared, which would have resulted in a far greater loss of lives. We knew that we could not escape the virus, but that we needed to delay its spread for as long as possible. In the time that we have had, we have taken important measures to strengthen our health response. We have conducted more than 2 million coronavirus tests, and community health workers have done an excellent job by conducting 20 million screenings. We have made available almost 28,000 hospital beds for COVID-19 patients and have constructed functional field hospitals across the country. We now have over 37,000 quarantine beds in private and public facilities across the country, and these are ready to isolate those who cannot do so at home. We have secured 1,700 additional ventilators, and companies in South Africa, some are automakers, some are manufacturers in the steel industry, and as well as the CSIR. They are in the process of producing another 12,000 ventilation devices for delivery between the end of July and the end of August. We have procured and delivered millions of items of personal protective equipment to hospitals, to clinics and schools across the country to protect our frontline workers. We have recruited and continue to recruit additional nurses, doctors, and emergency health personnel. We, however, still have a serious shortfall of more than 12,000 health workers, mostly nurses, doctors, as well as physiotherapists. Thanks to the contributions by the business and individuals, the Solidarity Fund has invested 1.9 billion rand in our health response, providing personal protective equipment and other supplies for our health facilities. It is generally known that the ultimate defense that the world could have against COVID-19 would be a cure or a vaccine. A vaccine against this virus does not exist at this point in time. South Africa has joined and is playing an important role in the global effort to develop vaccines and medicines to treat COVID-19. Our country has an established vaccine manufacturing capability, as well as the expertise in the development and trial of a range of vaccines. We continue to make progress in our efforts to deal with COVID-19, but our greatest challenge still lies ahead. Health facilities in several provinces are already under tremendous strain. We have heard of instances where people who are infected have been turned away from health facilities due to a lack of beds or essential supplies. This is deeply worrying. It means we have to move with even greater urgency to strengthen our strategy to manage the peak of infections. We are focusing on a number of priority actions in the coming weeks. Across all provinces, we are working to further increase the number of general ward and critical beds available for COVID-19 patients. This is a task that will be undertaken. Ward capacity is being freed up in a number of hospitals by delaying non-urgent care, the conversion of some areas of hospitals into additional ward space, and the erection of field hospitals. We are working to increase supplies of oxygen, ventilators, and other equipment for those who will need critical care, including by diverting the supply of oxygen from other purposes, and the private sector is cooperating in this. Due to the lack of critical care facilities in rural areas, measures are being put in place to refer patients to better equipped urban areas. To deal with shortages of health personnel in some areas,